So we'll start with injuries around the shoulder now. So first is shoulder dislocation. Shoulder dislocation. Before going into the shoulder dislocation, we'll just go through a short anatomy of shoulder joint. Shoulder joint is an ball and socket joint. Shoulder joint is a ball and socket joint. If you see the shoulder joint is between a bone called as scapula and the humerus. So what part of the scapula forms the joint? This is the glenoid cavity. So this cavity is called as glenoid cavity, and this part of the humerus is the head of the humerus. So head of the humerus is like a ball and the glenoid cavity is like a socket. So that is why it is called as a ball and socket joint. That is why it is called as a ball and socket joint. Can anyone tell me any other example of ball and socket joint? You know? Hip. So hip joint is an example for ball and socket joint. Now, what is the difference between the ball and socket joint of the hip and the shoulder region? Now you take a bowl, okay, you take a bowl and you keep a ball within the bowl, okay, and you take a saucer plate, you know, cup and saucer plate, and you keep a ball over the saucer plate. You compare these two, which is more stable, a ball within a bowl or a ball over the saucer plate? Ball in the bowl. So hip joint is like a ball within a bowl. The cavity is so deep, it does not dislocate. But shoulder joint is like a ball over a saucer, so it easily dislocates. So shoulder joint are more prone for dislocations. Shoulder joint dislocation is the most common dislocation seen in the body. Shoulder joint dislocation is the most common dislocations because of its unstable nature. Okay, because of its unstable nature. But because of this unstable nature, it is gaining one more advantage. What is the more advantage you have with the shoulder joint? Mobility. You have more mobility in the shoulder joint compared to the hip joint. In the hip joint, it is not that mobile, but it is more stable. Whereas shoulder joint is more mobile, but it is less stable. Okay. Now, if it is such a unstable joint, there must be some factors to prevent dislocation. So the main factor which prevent dislocation of the shoulders are two. One is the dynamic stabilizers. Another one is static stabilizers. What are these dynamic stabilizers means? Dynamic means it keeps moving. It keeps moving. So what is the structure that moves? The muscles. So what are the muscles which are around the shoulder joint that prevents the dislocation of shoulder joint? Those muscles are called as rotator cuff muscles. Those muscles are called as rotator cuff muscles, and there are 4 rotator cuff muscles. Goes by the mnemonic SITS. Sits. It's called a sits muscle. S stands for supraspinatus. I stands for infraspinatus. T stands for teres minor, and S stands for subscapularis, and S stands for subscapularis. Okay. What are the static stabilizers? You got a labrum, which is called as glenoid labrum. It's called as glenoid labrum, and there is another static stabilizer called as glenohumeral ligaments. Glenohumeral ligaments and capsule of the shoulder joint. All these are static stabilizers which prevents the shoulder joint from getting dislocated. Okay, now we'll just see a small diagram for shoulder joint, and I'll tell you what is the importance of this one. The shoulder joint, as I already told you, it is formed between the glenoid and the proximal humerus, the head of the humerus. Now there is a muscle which comes over the joint. It's called as the supraspinatus muscle, and there is a muscle which comes anterior to the joint, which is called as the subscapularis muscle, and there is a muscle posterior to it, which is nothing but the infraspinatus and the teres minor. So what are these muscles? These muscles are the rotator cuff muscles: supraspinatus, subscapularis, infraspinatus, and teres minor. Now, can anyone from this diagram appreciate which part of the joint is not covered by muscles? 4 options: anterior, superior, posterior, inferior. Which part of the joint is not covered by muscles? Inferior. Okay, so this part is not covered by muscles. So the joint is weak in which part? Inferior part of the shoulder joint is weak. Inferior part of shoulder joint is weak. Okay, now can anyone tell me what is the most common dislocation which is seen in the shoulder joint? Anterior, posterior, inferior. What is the most common dislocation seen in the shoulder joint? Anterior, posterior, inferior. What is the most common type of shoulder dislocation seen? Anterior. Everyone goes with that? Anterior shoulder dislocations are most common. Anterior shoulder dislocations are most common. But the shoulder joint is weak where? Inferiorly. But inferior shoulder dislocations are rare. Anterior shoulder dislocations are most common. Anterior shoulder dislocations are most common. What is the reason for this? So the reason for the shoulder joint to get dislocated is because of the mechanism of injury. Because of mechanism of injury. So usually the most common mechanism which happens in the shoulder joint that causes dislocation is abduction and external rotation injury. Abduction and external rotation. Okay. Abduction and external rotation. Now just can anyone tell me what is this action called as? What is this? This is abduction. And what is this? This is adduction. Okay. What is this? This is internal rotation or medial rotation. What is this one? This is external rotation. Okay, clear? And what is this action called as? This is circumduction. This is circumduction or not rotation, it's called a circumduction. Okay. So shoulder joint can abduct and adduct. It can flex and it can extend. It can internal rotate and it can external rotate and it can circumduct. So many axes the shoulder joint moves. That is why this joint is called a multi-axial joint. That is why this joint is called as a multi-axial joint. Now, commonly, the most of the actions in the shoulder joint requires abduction and external rotation. What is the most common sport being played here? Cricket. So you throw a ball. What is the action goes now when you throw the ball?
External
goes for abduction and external rotation. So when the shoulder joint goes for abduction and external rotation, the joint dislocates. The most common mechanism which happens in the shoulder is abduction and external rotation. Because of that, it causes anterior dislocation. That is why anterior dislocation are most common. That is why anterior dislocations are most common. Okay, clear? Any doubt in this? No. Now, whenever a shoulder dislocates, okay, anteriorly, there are three regions the shoulder head of the humerus can reach. Based on that, anterior shoulder dislocations are classified into three types. Anterior shoulder dislocations are classified into three types. One is preglenoid, another one is subcoracoid, and the last one is subclavicular. Subclavicular. And of this, subcoracoid is the most common type of anterior shoulder dislocation. All these are MCQs. So please pay your attention. Anterior shoulder dislocation is the most common type of dislocation in shoulder. Of the anterior dislocation, there are three subtypes: preglenoid, subcoracoid, and subclavicular. The subcoracoid is the most common type. Subcoracoid is the most common type. Now, whenever a shoulder joint gets dislocated, the nerve, always remember, dislocations are usually associated with nerve injuries. Dislocations are usually associated with nerve injuries. So, shoulder dislocation, anterior shoulder dislocation most commonly injures a nerve called as axillary nerve. Most commonly injures a nerve called as axillary nerve. Axillary nerve supplies the lateral aspect of your shoulder region. Upper lateral aspect of your shoulder region is supplied by axillary nerve. Now, can anyone tell me what is this area called as? Where the military personnel put a badge here, that is called as the regimental badge area. So, axillary nerve injury causes regimental badge area anesthesia. Regimental badge area where it gets anesthetized. Okay, so regimental badge area anesthesia is caused in axillary nerve injury. Axillary nerve injury most commonly seen in shoulder dislocation. Okay, now axillary nerve supplies two muscles. Axillary nerve supplies two muscles. One is the deltoid muscle and another one is the teres minor muscle. Another one is teres minor muscle. The main muscle deltoid causes abduction of the shoulder joint. Okay, so whenever axillary nerve gets injured, abduction is lost. Abduction of the shoulder joint is lost. Abduction of the shoulder joint is lost. Now there are various clinical tests to diagnose shoulder dislocation. So the clinical tests to diagnose shoulder dislocations are again repeatedly asked MCQs. One test is called as Dugas test. One test is called as Dugas test. Very simple test. See, whenever a patient comes with a shoulder dislocation, in what attitude you come? He will come with the shoulder slightly abducted, and he will be keeping the other hand to hold it. He will come to you. Will come to your clinic like this with this attitude. So you diagnose it as shoulder. Clinically, how will you diagnose? By means of a test called as Dugas test. What is Dugas test? You ask the patient to touch the opposite side shoulder. You will not be able to do it. This test is called as Dugas test. You ask the patient to touch his opposite side shoulder. You will not be able to do that. So that test is called as Dugas test. One test to diagnose shoulder dislocation. The next test is called as Hamilton ruler test. Hamilton ruler test. Hamilton ruler test. Hamilton ruler test is very simple. You take a scale and you keep it over the lateral side of the arm, so that the upper part of the scale touches the acromion. Normally, if the upper part of the scale touches the acromion, the lower part of the scale will not touch the lateral condyle of the humerus. You get a bone here for the lateral condyle of the humerus. If the shoulder has got good contour, if you keep it over the lateral aspect, it won't touch the lateral condyle. But if the shoulder has got dislocated, it flattens out. So this will touch both the acromion and the lateral condyle. So this is called as Hamilton ruler test. Again, clinical test to diagnose shoulder dislocation. The next test is Callaway's test, where there is an increased axillary circumference. Vertical circumference of the axilla is increased. So that test is called as Callaway's test. Increased vertical circumference of the axilla or increased vertical girth of axilla. So this is called as Callaway's test. So these are the various clinical tests to diagnose shoulder dislocation. Okay. So by using Dugas test, Hamilton ruler test, and Callaway's test, diagnose shoulder dislocation. Okay. So if you see here, what is the area which she is checking for sensation?
Deltoid.
Regimental batch area. That is the regimental batch area. So if there is anesthesia in this region, what is the nerve that is injured? Axillary nerve. Injured in shoulder dislocation. Okay, clear? So this is about the shoulder dislocation, and these are the various tests. Now, what are the things that can happen when your shoulder gets dislocated? So I'll just draw a cross-sectional diagram to tell you what happens. Now, this is the scapula, and the scapula forms a cup-shaped structure called as glenoid cavity, and this cup-shaped structure is further deepened by a structure called as glenoid labrum. Okay, what is the green color structure represents? That is glenoid labrum. Glenoid labrum is a dynamic stabilizer or a static stabilizer? It is a static stabilizer. Very good. It is a static stabilizer. Now, what is the structure which is sitting within the glenoid cavity? Is the head of the humerus. Is the head of the humerus. Okay. Now what happens? Let us consider this is anterior side of your body and this is posterior side of your body. Now, if it dislocates like this, then what is this dislocation called as? It's called as anterior dislocation. Now, when head of the humerus dislocates anteriorly, what is this structure called as? Glenoid labrum. It tears the glenoid labrum and goes. So, whenever there is an antero-inferior tear of glenoid labrum happens, please, these words are very important. When an antero-inferior tear of glenoid labrum happens, then that lesion is called as Bankers lesion. Then that lesion is called as Bankers lesion. Then that lesion is called as Bankers lesion. Okay, clear? So this tear happens in the glenoid labrum whenever the shoulder joint dislocates anteriorly. So the antero-inferior tear of the glenoid labrum is called as Bankers lesion. Just at this junction, we'll discuss one more thing. Just if the shoulder joint dislocates posteriorly, if the head of the humerus dislocates posteriorly, then what is that dislocation called as? Posterior dislocation. Now, when it dislocates posteriorly, this part of the labrum gets torn off. So that means posterior inferior portion gets torn off. Then that lesion is called as reverse Banker's lesion. Then that is called as reverse Banker's lesion. And reverse Banker's lesion is seen in which dislocation? Posterior dislocation. Banker's lesion is seen in which dislocation? Anterior dislocation. Very simple. Okay. Now with this, we'll go to the next important aspect of this dislocation. One is, so this is glenoid cavity. Now what happens? The humerus has got dislodged anteriorly. Because the humerus has got dislodged anteriorly, humerus is like a soft bone. The proximal part of the humerus is like a eggshell. When it goes proximal, when it goes anteriorly, it hinges over the glenoid, and it causes a lesion here. It causes a defect here. This defect, which happens in the humerus, is called as Hill-Sachs defect. What is this defect called as? It is called as Hill-Sachs defect. And Hill-Sachs defect occurs in the posterior-medial portion of the humerus. Posterior-medial portion of the humerus. Okay, are you clear in this? So whenever the head of the humerus slips anteriorly, the glenoid compresses the head of the humerus and it causes a defect in the head of the humerus, and that defect is called as what? Hill-Sachs defect. And in which portion of the humerus it is seen? It is seen in the posteromedial aspect of the humeral head. Banker's lesion is seen in where? Okay, now we'll summarize. We'll summarize like this. Okay, anterior dislocation of shoulder, Banker's lesion is seen, and Hill-Sachs lesion is seen. Okay, whereas posterior dislocation of humerus of shoulder joint, reverse Banker's lesion is seen, and also reverse Banker's lesion, and also reverse Hill-Sachs lesion is seen. Reverse Hill-Sachs lesion is seen. Reverse Hill-Sachs lesion is seen. Okay, clear? So these are all MCQs which comes frequently from the shoulder dislocation topic. Shoulder. Any doubt on this? Okay, we'll move to the next part of the shoulder dislocation, that is posterior shoulder dislocation. So posterior shoulder dislocation, I have already told you few signs from posterior shoulder dislocation, that is the reverse Banker's lesion and the reverse Hill-Sachs lesion. In whom commonly posterior dislocation occurs? Posterior dislocation commonly occurs in electric shock. When a patient has got electric shock, or when a patient has got epilepsy, okay, it causes posterior dislocation of shoulder. So this is very simple. So posterior dislocation is seen in epileptic patients. Posterior dislocation is seen in patient who has sustained electric shock. Whenever there is a posterior dislocation, two lesions are seen. One is reverse Banker's lesion, another one is reverse Hill-Sachs lesion. Whenever there is a posterior dislocation, this is the X-ray which will be seen. It will almost look like a normal X-ray, but this is not a normal X-ray. This X-ray is looking like an electric bulb. Okay, this X-ray is looking like an electric bulb. So this is called as electric bulb sign. This is called as electric bulb sign. So in posterior dislocation, you get electric bulb sign. You get electric bulb sign. So if someone asks you electric bulb sign is seen in which kind of dislocation? That is posterior dislocation of shoulder. That is posterior dislocation of shoulder. Okay, fine. The last dislocation is inferior dislocation of shoulder, which is very, very rare. Though the shoulder joint is weak inferiorly, shoulder joint does not dislocate inferiorly, which is very, very rare. Okay, clear? Fine. So this is about the shoulder joints. And how are you going to treat a shoulder joint dislocation? So how are you going to treat it? So you can treat it by various methods. See, this is first dictum in orthopedics. Dislocations are emergencies. Dislocations are emergencies. So that has to be treated at the earliest. So you have got various methods to reduce shoulder joint. The method which is most commonly used is modified Kocher's method. modified Kocher's method. Okay. The next method, which is not used commonly, which are outdated, are Stimson's method. Stimson's method, which is a gravity assisted method, And last one is an Hippocratic method, where they use a axilla, they keep the foot over the axilla and they reduce it. It's called as Hippocratic method. Okay, so these are the various ways to reduce the shoulder joint. Okay, so we'll just move to the next part of the fracture, proximal humerus fracture. Okay, see, now the shoulder joint has got dislocated, and you reduce the shoulder joint by means of various methods. Okay, like Stimson's method or by modified Kocher's method, you reduce. But there is one problem with shoulder joint. Shoulder joint goes in for recurrent dislocations. Shoulder joint goes in for recurrent dislocations. So this is one more problem with shoulder joint. Shoulder joint can go in for recurrent dislocation. So recurrent dislocation of shoulder joint, if it happens, it requires surgery. Two surgeries which are used to treat recurrent shoulder joint dislocation. One is put-it flat operation, and another one is called as letharget procedure. Okay, just have this names in your mind more than enough. Don't worry about what do they say. Put-it flat operation and letharget operation are two surgeries which are performed to prevent recurrent shoulder dislocation.